Since 2013, there is a new healthcare law in the United States that requires healthcare providers and manufacturers to disclose certain financial transactions. This law is called the Physician Payment Sunshine Act, or simply the Sunshine Act. Under this law, pharmaceutical manufacturers are now required to report data on payments and transfers of value that they have made to physicians and teaching hospitals annually. The Center for Medicare and Medicaid Services, or CMS, has been charged with implementing the Sunshine Act. Let's see why this reporting is such a difficult task. Harry is a compliance officer at Smile Pharmaceutical, a mid-size pharmaceutical manufacturing company. Harry's boss, Bob, has given him the task of filing this year's Sunshine Report. Harry thinks that this is an easy task. He goes back to his office, downloads the field expense reports of all the sales reps, and gives them to Bob. Bob is furious seeing this.
Wait a minute. Is this all the data on Sunshine? A lot of this is irrelevant. Why is the data so complex? There is so much data and so little information. Do you know we may have to face penalties up to $1 million for incorrect reporting?
A confused Harry goes back and starts working again. This time, he pulls out data from the CRM, ERP, accounting software, spends weeks cross-checking, re-verifying, and formatting. Finally, he merges all the Excels and goes back to Bob with this information.
So many of these expenses don't have any physician mapping. And what about the ownership interest of physicians? I'm sorry, Bob, but there are many physicians who have the same name. I can never be sure of the National Providers Index mapping of these physicians. Plus, there are bound to be errors when you are manually dealing with a huge amount of data spread across many systems.
After they have spent a lot of energy, Bob and Harry are nowhere near the reporting. And this is just the beginning. The Sunshine reporting has to be done each year.
Are there any better ways to do this?
Yes, there are, but none of them suits our requirements fully. I have to either fill all the data manually or create an Excel and then upload it into the reporting application. Either way, the main challenge of getting the data from different sources does not get solved. Bob searches over the internet and finds InApp Inc. and engages with them to automate Sunshine reporting. In brief, this is how InApp's Sunshine reporting application worked for Smile Pharma. Smile Pharma uses Salesforce for recording physician-related expenses incurred by their sales reps. All funding towards teaching hospitals are tracked on Microsoft Dynamics. Some data is shared on their custom application and Excel files. The Sunshine reporting application, with its custom-build connectors for Salesforce and Microsoft Dynamics, imports this data and cleans it. Missing NPI data is auto-matched from the NPI registry. After verification by Bob and Harry, the finalized data is converted into formats which can be uploaded to the CMS website. Bob and Harry are relieved. They successfully filed the Sunshine report. Bob and Harry are very happy with InApp's engagement model, which starts with understanding of systems, identifying data loopholes, suggesting the best customized solution, jointly verifying the collated data, and finally deploying the solution. InApp Inc. has been working with pharmaceutical companies on their Sunshine Act reporting since 2013. We have been in the business of software development and consulting since 2000 and have delivered about 550 projects to date. InApp has a long history of association with pharma sectors, having dealt with pharmaceutical companies, healthcare device manufacturers, hospitals, clinics, and insurance companies. We have done projects related to enterprise-level software for pharmaceutical companies, compliance solutions for device manufacturers, revenue cycle management solutions for hospitals and clinics, mobile applications for healthcare solutions, and many others. Our customers rate us high on familiarity with statutory laws, on-time delivery, user-friendly solutions, and hassle-free customer engagement. Contact us today for automating your Sunshine reporting.